Via Zoom is Congressman Bera. He is joining us from his home in Elk Grove, California, just south of Sacramento. He represents the 7th Congressional District. I know you've been hearing part of the conversation. You also come to the table with a medical background. What is
internist by training, but was chief medical officer for Sacramento County, so ran the public health department, and then my old institution was University of California, Davis Medical School.
So how is the U.S. handling this public health crisis?
You know, I think we're doing the best that we can. I mean, it was unfortunate that we weren't able to get testing capabilities ramped up as quickly as we would have liked. But, you know, under the current circumstances, the stay-at-home order across this country right now seems to be working. Certainly, we had early cases here in California, and, Governor Newsom's early action, our local public health folks, our mayors, it seems to be working here in California.
When we get beyond this pandemic, we have a vaccine, and we look back at lessons learned. What would you apply? What needs to be done differently down the road if we have another pandemic like this one?
And we are going to have another pandemic. We've had SARS, MERS, H1N1, Zika, Ebola. So we know viruses are out there and viruses will change and mutate. So there will be another pandemic at some point. Maybe not as bad as COVID-19, but so what we have to do is right now, let's build the public health infrastructure that helps us deal with the current challenge, but actually starts to build a public health infrastructure that we as the United States of America can be proud of, that will protect us and help us with that next pandemic. Second, let's build a global health security infrastructure that works with countries around the world, leverages limited resources, and starts to think about things slightly differently. The world is interconnected today, and viruses don't respect borders, they move. And now people are paying attention to pandemic preparedness.
Congressman Bera, you are in Central California. What's happening in your district? Who are some of the largest employers, and how are your constituents dealing with all of this?
This is tough for folks in California and folks all across this country and all across the globe. We've essentially shut our economy down. So that said, everyone knows we're in this together. We are, working together as a community, as a state, looking after one another, following the stay-at-home orders unless you're doing an essential activity like a doctor or nurse. And again, our hats off to the folks that are out there on the front lines. Again, though, we also realize that, if we can flatten this curve, if we can avoid the hospitalizations that you're seeing in New York and elsewhere, then maybe we can start thinking about what comes next. How do you safely reopen communities?
And again, under the category of lessons learned, what did California do that New York may not have in terms of the number of deaths that we're seeing across New York State compared to California?
I think Governor Newsom, our local mayors, our public health officials, with early social distancing when people are out in public, early basic hygiene sanitation recommendations, but then fairly quickly going to voluntary stay-at-home orders and then maybe mandatory stay-at-home orders sooner than any other state probably did help us here in California, certainly Washington State and the West Coast. I also think we have some basic advantages. We are a commuting culture out here in California, so that probably protected us as opposed to the subways that you see in some older East Coast cities. And we are a pretty wired community in California as well. Not all of California, but large portions. So folks could more easily telecommute and telework.
How are you communicating with your constituents? Are you holding teletown halls, and how are they giving you their concerns or questions?
We're holding those telephone town halls, and you've seen record participation on those. We're also doing lots of smaller calls with nonprofits, small business owners, et cetera, just trying to be a conduit to hear what's going on the front lines and connecting folks with resources. But again, this is something that is affecting every part of this country and every part of the world.
We learned today from Congressman Steny Hoyer that the House is not scheduled to return until May 4th unless there is a need for all of you to return, which is also renewing the debate on remote voting. Do you support that?
I do. I actually think in unusual circumstances like we find ourselves in with this pandemic, we have to embrace technology. And, it might not happen in the current crisis, but I think we ought to adjust our rules in a way that works within the Constitution, but allows us to, in extreme circumstances, operate remotely.
And do you have a sense of this next round, this next tranche of aid that is being debated? The Senate Republicans want $250 billion, but Speaker Pelosi and others want more money for states and also for schools and hospitals.
So we're open to the $250 billion to continue to help our small businesses. We just want to make sure it's getting out to a lot of those mom and pop businesses, a lot of those folks that are actually hit pretty hard by this. And we're worried that, some of the bigger, well-connected banks are only working with established clients. And, that wasn't the intent here. It was to help every small business owner. In addition, we know our hospitals, community health centers, and others need additional funding. So we've got to get that funding plussed up as well, because they're hurting and they're on the front lines right now. So, and then, the original Paycheck Protection Program had some great things in it, but there's some things that we should fix, like the nonprofit sector.
What has your routine been like over the last couple of weeks, and are you prepared for another 3 weeks of this?
I'd love to get back to work, but we've got to put the safety of the country first and let the data dictate and the science dictate when we're ready to go back to work. That said, the days start pretty early because most of my DC staff is obviously teleworking from the East Coast. So 7 or 8 o'clock in the morning, staff check-in calls. Being a doctor and someone who focuses on public health and pandemic preparedness, there's call after call. And then, as chairman of the subcommittee on Asia and the Pacific, I'm also trying to keep my committee engaged. So we'll do briefings, et cetera. And that's another thing. If we are in a prolonged lockdown, I'd love to have some of these briefings and other meetings televised on C-SPAN and elsewhere, so the public can actually see the kinds of questions that we're asking.
We would love to televise them, so if it happens, let us know. But as you have gone through all of this, what have you learned about the way the House operates and the way your own schedule operates?
Yeah, the House is a pretty traditional organization, so some of it's mandated by the Constitution, some of it's mandated by our own rules, and under normal circumstances, it is always good for us to be together and operating in a transparent way so people can see what we're deliberating, the debate that's going on back and forth. But under extreme circumstances, we probably ought to have the flexibility to take advantage of technology. In addition, I think this pandemic really has demonstrated, and we know we'll continue social distancing, but the ability of folks to telework from home, the ability to continue to hold meetings, to meet with constituents and other groups, and probably does accelerate the use of technology, not just in government, but also in healthcare and other aspects of our lives.
One final very quick follow-up. Will we see this technology this summer? You're a Democrat. The convention scheduled for Milwaukee. The DNC chair, Tom Perez, saying he intends to have all the delegates there. But is that feasible without a vaccine?
I think large gatherings are going to be the last thing that comes back. And, obviously, political conventions are large gatherings. So unless you can do it in a safe way and have appropriate social distancing, then I can very much see a virtual convention.
Congressman Ami Bera from California's 7th Congressional District joining us from his home in Elk Grove, California, just south of Sacramento via Zoom. Congressman, be safe. Thank you for being with us.
Thank you. Be well.